Welcome to Hair Transplant Step by Step, episode number 2. In this episode, we are talking about FUE, follicular unit extraction. FUE is one of the technique of hair transplantation which is very commonly performed these days. In the past decade, the number of cases undergoing FUE, hair transplant surgery, has increased drastically, mainly because of the simplicity and ease of the surgery for the part of the patient. Now, as the number of cases undergoing the surgery has increased, the number of centers performing the surgery has also increased. And there is always first and most important question for the patient: where to undergo hair transplant surgery, from whom to get the hair transplant surgery. Many times they get guided or misguided by multiple parameters. What we are trying to do in this series is give some scientific information based on which you will be able to judge differences between different centers and can take a wise decision about where you want to take your hair transplant surgery. Now coming to FUE. There are basically two steps in FUE: extraction and implantation. Extraction is taking out hair from the back of the head, and implantation is putting them back in the bald area at the front of the head or center of the head. First, let's talk about extraction. Extraction, when we are taking out hair from the back of the head, it depends upon multiple factors which ultimately lead you to good quality graft or not so good quality graft. Of course, your hair are one of the most important criteria. You should be having good hair at the back of the head, or at least average hair at the back of the head, in order to give you good grafts. But apart from that, the machines which are used for extraction, the punches which are used for extraction, and of course expertise of the doctor, these make a lot of difference on the quality of graft that you have taken out. I usually tell my patients, in order to make a good product, you need to have good raw material. If the raw material is good, the chances of giving a good product are increased. But if the raw material itself is not good or damaged, there are less chances that you can end up getting a good, strong and sturdy product. So extraction is all about getting a good raw material for implantation. Out of these three things, right now we are talking about the punches used for extraction. It's a simple tool which encircles the hair follicle, the outer hair follicle. It cuts the skin surrounding the hair follicle, dissects the soft tissue around it and takes out the hair follicle, so that you have the follicle along with the root ready for implantation. So punch, in layman term, you can consider it as a drill. It's basically a drill which separates the follicle and takes it out. A very simple thing. Most of the times what patients know about punches is, what's the diameter of the punch used? That's one of the common questions which patients ask. What diameter of the punch do you use for your hair transplantation? Now diameter is just one parameter which decides what quality of graft you are taking. I usually answer this question, it depends upon, it's like your finger and your ring relation. Your ring should be exactly of the size of the finger. It should not be very big, it's of no use. It should not be very small, again it's of no use. So the diameter of the punch should be optimum to the diameter of your hair. If you have a thick hair, you need a wider punch. If you have a thin hair, you don't need a wider punch. You can end up with small punch. But smaller the size, better the punch, no, that's a wrong notion. You need it optimum. Most of the times, most of the Indian patients, they end up with a punch size of 0.8 millimeter or 0.9 millimeter. Sometimes with beard hair extraction, we may go even on a lesser side, beard hair or body hair extraction. Sometimes with thicker hair extractions, more of triple hair follicles inside one graft, we end up with larger size of punches. But the idea is, this all range is normal. It's not that the smaller the better, the larger not better. It should be optimum. Now when I say optimum, what happens if you use a larger punch when it is not indicated? As we know, in the hair, they are all very closely aligned to each other. If you are using an optimum punch to take out the hair, it's fine. But if you are using a very large punch, you end up damaging the surrounding hairs. And if you are using a very small punch, you end up taking out a very skinny, that's what the term we use, skinny graft, which doesn't have enough tissue surrounding it so as to support the growth of the hair. So again, the optimum is better. So 0.8 or 0.9 millimeter is the optimum size in most of the Indian male hair densities and Indian male hair diameters. So size of the punch is one criteria, but it is not the only criteria. There are many other parameters which come under the heading of shape of the punch. Another important criteria for punches is shape of the punch. Now why it is important? Hair follicles which are growing out of our skin are usually either single hair follicles, two hair follicles, three, and sometimes four. Now all these hairs growing out of a single graft has different internal arrangement. Single of course has only one hair inside it, two has two roots inside it, 3 has 3 roots inside it. Now in these arrangements, what we can see is that hair roots are parallel to each other. These are one of the simplest grafts to extract. You use punch of a particular size and then you take it out properly. Because the hair roots are parallel to each other, they will not transact and they'll come out easily. But then you have few arrangements in which you have splayed end of the graft roots, in which hair roots are not parallel to each other. Instead, they are going in all the directions. Sometimes they are widely spaced apart, in which the outer punch diameter need not necessarily match the inner diameter of your graft thickness. Sometimes they are curly, more curly, and sometimes out of two hair graft, you have one hair root being long and the second hair root being short and splayed out. Now you need a punch design which can take care of all these different types of graft arrangements in order to take them out properly. If you are using just a blanket punch, say for example 0.8 millimeter size punch for all of them, in this scenario, when you go deep in, you will cut the root. The same will happen in this scenario. The root will be left inside and what you will take out will be the dead part of the hair. These grafts are no good for implantation. So that's why there are different shapes of the punch designed in order to take care of different internal anatomies of the graft roots. And if you use the right size and right shape of the punch in a right patient, you can extract beautifully nice and healthy grafts. So shape is one criteria. You may have routine cylindrical punches, you may have flared punches, you may have punches with outer sharper edge and inner blunt edge. You may have punches with inner texture. These are all little scientific terms, but all that I want to tell here is there is a wide variety. It's a big armamentarium of the punch size and shape, and you have to choose which shape will be applicable in which type of patient. So shape is one criteria, and the third criteria is the depth. That at what depth you are using the punch, till how deep you are going in order to extract the graft properly. Some punches have a prefixed depth, while some punches depth can be adjusted. Now, as in this figure, the more deep you go straight, you can still extract a proper graft. But in this, if you go more deep, you'll end up transacting it here. We don't want that. So you need a depth control so that you take out the graft in toto, but at the same time, you loosen it up at the level where it is needed. So when you take care of all these three criteria, not only size, but also the shape and depth, you get good and healthy grafts. So next time, when you are doing your research about your own hair transplant and how you want to go ahead about it, you make sure that you have answers to all this size, shape and depth of the punches which are being used, or else you have a proper person who has enough knowledge about it. Just size is not the important thing. I hope this episode gave you some insight about the punches, which are one of the most important tool for hair transplantation. See you in next episode. Thank you.